clinicals. You know what? Let me switch that up a little so you guys can see my little stuff behind. If you guys didn't know, I'm really into Vampire Diaries and the originals. That's the reason why I get stuff like this. And I'm really into Hopes as well. You know, it's kind of like not a part of the saga, but I haven't saw the DVD yet, or maybe I saw it anyway yet. But it is what it is. It's having a point now. So what's up, guys? I hope you guys are doing pretty well. We are personally doing fine. We're just chilling after all our shipping. We're gonna do another one like in literally like 2, maybe 3 hours, I guess. 2 hours, literally. But we're gonna be talking about clinicals, going to clinicals because I know it's really excited. You know, if I go to clinicals finally, and knowing that my program does clinical is you go to clinicals after I think foundations or when you kind of like dip into your first foundation term, and it was one of the best thing ever because they got a stethoscope, you know, kind of like know how to use a stethoscope, you kind of like know what to say, and it's just like, oh damn, I'm finally doing it. But honestly, the way that I see clinicals now is you're cosplaying for the whole day where you're not gonna get paid. That's like that's it. I do get the fact that you know, there's the experience part of it, you know, because you're being paired with an experienced nurse or somebody who's been doing the job for a really long time, and therefore you have this opportunity to have a mentorship pretty much for the whole day and having advice and just be in the job and kind of like see what it is your life will be as soon as you graduate and stuff like that. But I'm still not okay, or I still can't wrap my head with the fact that, hey, you know, this is literally a whole shift. This is literally a whole shift. I'm not getting paid for. And the reason why that makes this whole mentality of like, shit, I'm not getting get paid for and I really want to go home is sometimes when you do go to clinicals, right, based on the nurse you'll be assigned to, well, the nurse can either make it a nice thing, a nice time, or a worse time. Like one of the reason why it might be a worse time, like I might be assigned to a nurse and the nurse just spend like the whole damn day trying to avoid me, which I really do not understand. People would tell me, oh, you know, the workload is really heavy, they got a lot of stuff to take care about. It all comes back to managing and being nice to a nice human being, because at the end of the day, before you were a nurse, you surely did that clinicals and you surely did had other people, you know, you were not mentoring, you were shadowing, and you had to do this. You pretty much had to do this. So why the hell you had to do this? You went through it, you're on the other side and you're trying to help somebody else who's going through the same thing as well. It doesn't make any sense to me. Like literally, bro, literally, like I'll literally have nurses try like hide away or giving you stuff to do that generally doesn't have any, what I'll say, I'll probably hate some haters with this, but I don't really care. Well, stuff that I'm not gonna say not gonna help you for the job, but giving you stuff that generally does not make any sense. For example, right, they will go to clinicals and they're passing out trays. You're passing out trays, you have your patients, you're passing out trays to everybody, you're just helping people around, right? But you're passing out trays, the patient is on a regular diet, the patient is stuffed, but they want you to just, you know, help the patient eat. What am I gonna help the patient do? The patient is soft. The patient can pretty much like do pretty much everything by themselves. There is literally no reason somebody has to be in the room with them while they're eating. They're on a regular diet. Last time that I checked, they don't have anything that impair the swallowing function. Therefore, it does not really make any sense. But these are things that happen or that I see happening to other people, but not necessarily to me, because I'm quick to be like, I'm sorry, I did talk to the patients, that's what the patients need, and what's up, what are we doing? That's kind of the way that I go about it. Like, for example, I'll go to clinicals, right? So we'll have pre-conference in the morning and we kind of like talk about like general stuff, good to know what not to do, which I really like, because you know we get a little reminder of, you know, what it is you can do and cannot do. Sometimes it's really important because, like I said in my other videos, people don't really have any common sense, and it's good to kind of like reinforce that until they actually get it. All right, so I have the pre-conference, giving your patients and, you know, stuff like that. And then the way I go about it is I have a special paper, which is another thing that I really want to talk about. The paper that they usually give us in the morning, which is the one with like the whole medical condition, nursing and stuff like that. These I don't really use it. So I'll use it afterwards when my clinicals is done. I'll fill it out. But the thing that I do is I just get a regular sheet of pen to paper and I just fold this thing in like 4 6, and I'll just put different information such as patient's name, DNR status when the DNR was signed, power of attorney, medication list, medication taken, on the shift. What else do I usually have? Medical history, physical section, labs, all labs and results. And I'll have all the things on my paper, which are the things that the paper that they usually give us do not have, or at least have some of it, but not all of it. So I rather have and go by my own paper and make sure that I got all the informations that are pertinent with me taking care of the patients, kind of like get to know my patients pretty well instead of just like going by the paper that they give us. So yeah, this is another thing too. Like if they really usually give you a paper, I really don't know how your school do it, but the paper that my teacher is really giving me is not enough for me. So that's the reason why I do it like that. But if you think it's does cover everything that you will need to fully understand the patients and have a complete picture of what it is happening, there's literally no need to use the printer paper method, but just something needs to be pointed out. The other thing is not post conference. There was something that I was talking about before. Yeah, so we do that. I get my little paper and stuff, and I'm gonna go to the nurse. When I go to the nurse, I just tell them like, hey, my name is Sam, and I'm gonna be with you from 8 to whatever times I'm gonna be there, and what are we doing, literally. So they're gonna tell me, I'm gonna give this to so and so, or they're gonna tell me like I don't know. That's all I'm thinking about right now. They're gonna do this, and I'm just gonna tell them that, all right, so they're gonna do this. What are we gonna do next? So I try to have a really big picture of what it is they're gonna do. I just like 3 things they're gonna be doing for the next like 30 or 45 minutes. So I always have an idea of how, like, where I might find them or what they might be doing. Because one thing that I generally do not do is running after people. And it's not me being mean or just me being disrespectful, because some people might be like, oh my god, you're just being mean and disrespectful, kind of like feeling yourself way too much. But it's just that it doesn't not really make any sense. The clinical hours are, things for you to learn, like things for you to do. So it literally does not make any sense for me to follow you or just try to follow somebody for the whole damn whatever it is the clinical is, because if it's not a learning opportunity, there's literally no reason for me to follow you, because next thing you know is you're just gonna be using me to do all the things that I generally thought it's not really a learning opportunity. And I see some people complaining about the fact that they go to clinicals, right, and they just do CNA works and stuff like that. So they don't really do other thing they've been doing CNA work. It's just not what it is they're trying to do, which I get at some point. But the other things they do not get is every opportunity you get to do CNA work is an opportunity you have to be good with your physical examination skills, because you can literally do a whole physical as you're giving somebody a bath, or you can do a focus assessment as you're cleaning somebody up. There's always an opportunity for you to actually sharpen your skills, and some nursing will use it as, let me just let them do this so I can make them get the hell away. Oh jeez, I'm sorry, I just took a look at my mic. I thought my mic was not recording. That's the reason why. But let me put this back. But yeah, like I was saying, every CNA work, what people call CNA work, I generally don't know why they call CNA work, because at the end of the day, a patient will need to get clean, and there is a reason why the first thing that you learn in nursing school is how to make a bed and how to give somebody a bath, because this is literally nursing. Ain't gonna lie. That's a part of taking care of somebody and making somebody comfortable. But some people call it CNA work. Like each time you get the opportunity to do a CNA work, you get opportunity to get to know a patient a little better, because you will get to talk to the patients. You will get to see stuff that the patient may have not, remembered, or just may have not told you. And it's a really good opportunity to learn. But I do see that some nurses overuse it, or use it as a reason as to just keep you away from them, or keep you away from being in what they call their way, and just let them do the job, which honestly and nothing funny about that. I really don't know why they do it, but there is a good on pretty much everything in life if you try to look for it. But yeah, that's all I really gonna say, because I think I did cover a little bit of everything that I really wanted to say about clinicals. Clinicals essentials. For the people that be coming to clinicals with like Stanleys and whatever it is, what have you not, don't do it. Clinicals essentials are 4 things: water, paper, pen, stethoscope. That's all you need. You don't need nothing else. About maybe a little snack too, cause you know I don't want to be hypoglycemic and then your sugar drops and the next thing you know, boom, you pass out and stuff like that. But honestly, I just bring a tea with me, like those raisin tea kind stuff that I just go to what it's called Aldi to buy for literally for $5 and stuff. But I'm gonna start vlogging a little bit. You guys will kind of like see what it is I get to do and how I do it, which is pretty interesting. I just can't wait to actually start doing this because the only thing that I was waiting for is my a phone case. And honestly, this phone case is really good. I really love it. So I think I'm gonna be recording a little bit more now. And yeah, that's just all I really wanted to say about clinicals. I hope you guys have a really good day. I'm gonna finish some questions that I started now, a little bit earlier, and then kind of like think about how I want my nights to go, because there's a lot of questions to do. And I'll see you guys throughout the night. Maybe I'll vlog for the night. I really don't know how I'm gonna be doing that, but it is what it is. It's like one of the things I'm thinking about right now. So thanks for watching. I'll see you guys tomorrow, maybe later, for like a short 12-hour vlog. Nah, I don't think so.